So based on a secondary analysis that we did of a large randomized controlled trial of an early palliative care intervention introduced at the time of advanced cancer diagnosis, we enrolled patients and caregivers if they had one into the trial. So not every patient had a family caregiver enroll. We had 84 patients who enrolled without a caregiver, and we had 123 patients who did enroll with a caregiver. And so we looked at differences between patient survival based on whether or not you had a family caregiver. And we hypothesized that those having a family caregiver would have a higher odds of survival. They would live longer. Because family caregivers do so much for patients. They drive them to their appointments, they help them take their medications, they offer psychosocial, spiritual support. So my guess was, you must live longer if you have that type of support. And what we actually found was the opposite. Having a family caregiver was associated with decreased survival. But to qualify that a bit, and I think this is really important for people to understand, if you take into account marital status, gender, age, and whether or not you had an advance directive, the effect was qualified to the extent that having a caregiver is impacted by whether or not you're married. And so the survival was impacted by whether or not most people who were unmarried and did not have a caregiver tended to have a higher survival rate compared to others.